Hi, I'm David King-Lassman. This is Explore XR, and today I'm delighted to be joined by Richard Price, who is joining us from the United Kingdom. Hey, Richard, nice to see you.
Hey, David, absolute pleasure to be here. Thank you for inviting me.
So tell everyone, where in the UK are you today?
So I'm in Yorkshire, which is a county in the northeast of England, and it's currently snowing, so it's rather cold here, but it's very beautiful as well.
I know Yorkshire really well. It's one of the most gorgeous parts of the UK, and I encourage anybody listening to, if they get to the UK, definitely head up that way. So Richard, you work for Health Education England, which is part of the NHS. So I think it'd be great if we could begin by you talking to our listeners about HEE, its functions, its role, and also a little bit of information about the NHS and how that operates in the UK.
Sure. So National Health Service, or NHS as we affectionately know it, for me is one of the great achievements in the UK. It's nationalised healthcare, fully funded by the taxpayer, so it's free at the point of access to anybody that needs it, which means you don't get this situation where you've got people that potentially can't afford access to healthcare and things like that. Everyone has an equitable access to healthcare, which for me is really, really important, and one of the sort of great achievements of what we've done with the National Health Service. So obviously that requires a big workforce to do that. We've got in the region of 1.4 million people that work for the NHS in the UK. That probably makes us one of the largest employers in the world. Whenever I see the NHS being talked about, it's usually sort of in the top 5 big employers in the world. So you've got Walmart, you've got the US Army, the Chinese railways, those kind of things. And then you've got the NHS as one of the sort of top 5 big employers in the world. So it's a huge, monumental undertaking to train that workforce and manage that workforce. So the work of Health Education England is to look at the workforce planning, start thinking about some of the people that might want to enter the workforce, and then obviously support that those trainees to get placements within the NHS, and also to enter the workforce and keep them and maintain their training. So the team I work for within Health Education England is called Technology Enhanced Learning, and we have we look at the whole spectrum of different people that work in healthcare, all the way through from pre-16 when somebody first started to think about a career in healthcare, also looking at their undergraduate, postgraduate education, and then all the way into the workforce until they retire, essentially. So, like I say, supporting all of those different people that potentially work in healthcare, so doctors, nurses, paramedics, allied health professionals, pharmacists, the whole range of different people that you might expect to work in healthcare. And I guess our team specifically looks at how we can use technologies to support those people. So that could be using things like Hololens, or it could be using e-learning, or even starting to dabble sort of in artificial intelligence and machine learning, how we can use that to create adaptive learning and personalized learning experiences. So it's a really exciting team to be involved with.
All right. And now the NHS, of course, is it's a UK operation. HE is specifically England. Do they have similar operations in Scotland, Wales, Northern Ireland?
Yeah, so we absolutely work with partners across the border. So as you know, the UK is split into 4 nations. So there's England, Wales, Scotland, Northern Ireland. Scotland, for example, has NHS Education for Scotland, which is the equivalent organisation north of the border. We have NHS Wales that are responsible, and then the NHS in Northern Ireland as well, that have their own organisations that are responsible for the workforce. So if you add all of those together, I guess we're talking probably more than 1.4 million, probably 1.6, 1.7 million people that are working in healthcare.
Right. And the education component in healthcare isn't just about undergraduates, but it goes right the way through. Once you qualify as a doctor, as a nurse, you're continually retraining. Is HE touching those areas of healthcare as well?
Definitely. So I read a stat the other day, David, that the amount of healthcare knowledge doubles every 72 days, which is just bonkers. Wow. How can anyone keep up with that? And now, when I was born in the sort of early 80s, I'm a millennial. I think I read the stat. I think it was every 8 years it doubled. So I mean, it was possibly back then to keep up with trends and new innovations in healthcare and things like that. Now, it's a real challenge. So we've got this workforce that having to constantly refresh their knowledge. So that's done through professional revalidation, obviously, but we have a role to play in supporting that. So we do that through e-learning, through like I mentioned earlier, sort of virtual augmented reality, and lots of other sort of techniques like simulation and things like that.
Right. So obviously technology plays a massive part in the way that we train and retrain our healthcare workers. How important is it for you to stay up to date with what's happening at the technological kind of coalface, of innovation?
So for me, my role is essentially a subject matter expert. So I'm a learning technologies advisor, which sounds very grand, but actually what it means is I'm a subject expert that can be parachuted into a project or a piece of work and be able to advise on the best educational technique using technology in that situation. So actually keeping up to date, I mean, if it's 72 days doubling of knowledge in healthcare, I suspect it's even faster in the tech world. We know that there's sort of big players in this market, Google, Apple, all of these other big companies that are looking at this. So to try and keep up with those is a difficult task, but I guess we have a broad range of knowledge, and that's the best way. I've worked in IT for a number of years, so I guess it's transferring those skills, those knowledge to be able to advise people best.
Yeah. Technology moves so quickly. What would you say over the last decade or so have been some of the most exciting and transformative technological innovations that have impacted healthcare in the UK?
So I think we've seen an acceleration of this over the past 18 months, but I think even prior to that, in an educational space, we were starting to look at sort of using video for delivering seminars and things like that. In a clinical space, I think there's been some huge leaps, some huge approaches. We did we produced a paper a couple of years ago called the Tophole Review, working with an American physician called Dr. Eric Tophole, who's an incredible guy. If you ever get a chance to follow him on Twitter and things, he's done some incredible things. When we met him, he talked about doing a full body selfie. And I was like, what do you mean by that? And he said, you can plug an ultrasound machine into your smartphone now, and you can do a personal ultrasound on every part of your body. So you can take an X-ray, an ultrasound of your arm, and then that appears on your phone. So you can sort of self-diagnose almost if you're a physician or a clinician. So there are some incredible advances in that. And I think, like I say, this document talked about sort of different advances in robotic surgery, in artificial intelligence, in personalized medicine, genomic medicine, and things like that. So these are things that 10 years ago we just weren't talking about, but now really are starting to become a reality. And I think if you look at 10 years, 20 years hence, we're going to see a much more of a shift towards personalized medicine and people taking ownership of their own health rather than having to go to a hospital or go to a doctor. That will all be done by telehealth and things like that. So there's some huge advances. And like I say, we've got to train our workforce to be able to keep up with all of that. So we need to think about things like digital literacy, digital capabilities, health literacy for patients as well. So how do patients know what to do? How do patients monitor their own blood pressure or their own blood sugar levels and things like that? The Tophole really talked all about all of this. And like I say, we've got to keep our workforce upskilled with that, which I think is a really exciting thing, but also a huge challenge.
Yeah, it's interesting if we look at what's happened in the last couple of years with the pandemic. In some ways, the healthcare system had to kind of take a big look at itself and say, how do we adapt to this, remote world where it's very difficult for a patient to get into surgery? And actually, I think it's done pretty well in responding to the different dynamic of how patients interact with their healthcare providers. What are some of the big takeaways that you see from the COVID pandemic? And to what extent do you think some of the shifts in the way that we interact with our healthcare providers are going to stay?
So I think we've seen big leaps in terms of telemedicine, telehealth. So I'm not just talking about sort of online consultations with clinicians. And we know there's apps out there that potentially allow you to do that, to have those one-to-one with GPs and things. But we know there's also sort of wearable devices and things. You've got real-time monitoring of blood sugar levels, for example, using wearables that connect to your smartphone, for example. So those were starting to happen pre-pandemic. But what we've seen is that really accelerate over the past 18 to 20 months. Stuff that was previously sort of science fiction almost is now become a reality. And like I say, education has had to adapt as well. So we're starting to see a lot more sort of education delivered virtually and online. We're seeing a lot of people sort of having hybrid careers now, and that means hybrid learning as well as a result of that. So lots of sort of changes happening as a result.
And I'd love to get your thoughts on this. I think one of the things that's fascinating about the internet and the access that we all have to information, we all have become pseudo physicians, right? We get ill, we go to the internet, we self-diagnose. Sometimes that's good. I'm guessing sometimes that isn't good. To what extent do you think education needs to point a little bit towards us as individuals and non-practitioners to help us make better informed choices?
So I mentioned health literacy earlier, and I think that's key for me. When I talk about health literacy, what I mean is patients being able to critically assess that information and understand where they need to take lifestyle changes, for example, and things like that. We know that there's a lot of evidence to suggest actually there's a lot of misinformation out there, memes on Facebook and things. How do we sort of control that? How do we support people to make informed choices about vaccines, about their own health and things like that? So we're absolutely seeing some big changes in that. But like I say, key to that is health literacy. So I think there needs to be a training program through public health initiatives and things like that. I'm very privileged to be able to do a lot of work with the World Health Organization, and we have a program called Better Health. We're doing stuff with Malaysia, for example. The work I'm doing in Malaysia, we're really looking at lifestyle changes. So we've seen a big shift in reduction in communicable diseases, so things like malaria and things like that, which is absolutely fantastic. But correspondingly, we're also seeing a big change in non-communicable diseases. So that's lifestyle diseases. So myself probably included in that, eating too many mince pies at this time of year with Christmas coming up. But people needing to make changes and shifts in their own lifestyle. So we've been educating community health volunteers in Malaysia to be able to give those messages to their communities and help them to make better choices in terms of what they eat and doing more exercise and things like that.
Okay. So let's talk a little bit now about immersive technologies, because I know that you're passionate about it, Richard, and obviously here at GigXR, it's central to what we're doing. Can you talk about how you've seen immersive technology, and in particular extended reality, impact the way you're thinking about education in healthcare?
Absolutely. So the key challenge for us over the last 18 months has really been about how we educate people, or continue to educate people, when potentially they can't physically attend a ward because of the pandemic. So that means through clinical placements, and there historically has not been enough capacity to be able to give everybody the equal opportunity to be able to have those clinical experiences. Because the last thing you want is a doctor or a nurse having done lots of theoretical training but never actually physically met a patient or put a needle in their arm. So with clinical placements are an essential part of that ability to deliver a trained healthcare professional. So how do you do that in the middle of a pandemic when potentially you can't have lots of people mixing together without sort of extensive PPE and things like that? Well, we looked to virtual and augmented reality to do a lot of that. I mentioned briefly HoloLens earlier. That's one of the tools that we've been using. So if you imagine the HoloLens has an array of front-facing cameras, we can broadcast what the clinician that's wearing that is seeing back to a group of trainees that are comfortably sat at home or in a remote location away from the sort of effects of the pandemic and things. And actually, what we've anecdotally been told is actually students have a better experience using that technology because they can hear better, they can see better what's going on. If you think of a surgeon, a trainee surgeon in an operating theatre, they're often put in a corner of the operating theatre and having to crane their neck to see what's going on in the cavity and things if it's open surgery, for example. So it's not a great experience for them. When the surgeon is wearing the HoloLens, being able to broadcast that to the trainee remotely, they can ask questions synchronously on the HoloLens, for example, and that gives them the ability to actually see what's going on. And these are really sort of fundamental changes. But like I say, anecdotally, students actually prefer that to some of the more traditional methods of teaching.
And HE's made quite a significant investment in mixed reality. Do you want to talk a little bit about that and what you're hoping to see in terms of a return on that investment?
Sure. So we've spent a lot of money on buying headsets. So one of the big barriers to accessing this technology is not just the technical expertise, but it's also the infrastructure. And what I mean by infrastructure is things like Wi-Fi, but also access to the headsets themselves and the support associated with that. So we've made a significant investment buying several hundred of these headsets nationally, which is really a drop in the ocean given what I mentioned earlier about 1.4 million employees. But what we're doing is starting to take baby steps towards implementing this at a much bigger scale. So we've bought a few hundred of these devices, currently rolling out as pilots across the NHS, using those clinical experiences, and of course working with you, David, with GigXR, having sort of purchased your licenses for your software to be able to demonstrate those standardized patients, things like the COVID-19 patient, for example, which is one we co-funded.
Right, and let's talk about that COVID-19 application actually, because I think that was something that I know from our point of view we were super proud of. Now we built that in conjunction with HEE, with Microsoft. This was a direct response to the pandemic. That application was distributed free across the Microsoft HoloLens App Store. You guys came to us on that one. You know, what was your driver there, and how did you feel mixed reality was stepping up and providing some value?
So again, we obviously had to stop physical placements, which was a big challenge. So how do you deliver those clinical experiences without having people physically in the room? Well, obviously mixed reality had a role to play in that. So speaking with, we'd already been working with the University of Leeds, who were one of GigXR's big customers, and were using this extensively in their undergraduate curriculum. And we were working with them to explore how we could potentially employ this within a early careers setting. So people that had just graduated from university, perhaps we were building their confidence with some of the clinical scenarios and things like that. So we were specifically looking at that demographic. And GigXR and mixed reality really came at an opportune moment. We were setting up field hospitals in the early days of the pandemic. Some of the largest field hospitals in the world. I don't know how well you know London, but we had the XL Centre in Docklands, which is a huge, thousands of square metre facility. And we had hundreds of beds that had been set up as intensive care units within that building. And we were sort of thinking about, okay, how can we train the workforce to be able to deal with patients where they'd never seen the disease before, they'd never dealt with it before. And the way to do that at scale was really to start thinking about, okay, let's buy some HoloLenses, let's put a volumetric image on there. And that's really where we worked with you, with Dimension Studio, with Microsoft, to be able to pull this COVID-19 patient together.
Yeah, and as you mentioned, you know, one of the benefits of being able to access this kind of content through a headset is that you don't necessarily need to be up close and personal to an actual patient or craning your neck over somebody's shoulder. But more importantly, I think you can do this in a safe to fail environment. You know, if you take an undergraduate med student and put them in a ward with a bunch of COVID patients, there's obviously risk there. So that must have been a big benefit.
Absolutely. So we were using sort of UV sterilizers to clean the headsets between people, but we could put people in an isolated room and put them in the scenario, and somebody can monitor their progress remotely, talk to them through Microsoft Teams, that kind of thing, and be able to have a collaborative experience, but in a safe way. And I think that was really important for us. So again, we took over the O2 Arena, which is next door to the XL Centre. Again, this is a sort of 100,000 seater stadium. These are big places, and we use that as our training venue. So we could have people in sort of some of the boxes that would normally use for sort of VIPs and things like that, but being able to actually use those as training spaces where they could put the HoloLens on and experience that patient firsthand.
Fantastic. So I don't want to put you too much on the spot here, Richard, but looking forward, and again, I know that you guys are making a big investment in immersive technologies. Where do you think mixed reality is going to apply itself effectively as you try and address, you know, your objectives of educating across the NHS?
I think this clinical placement capacity issue isn't going to go away. So I think we're going to continue to need to use some sort of mixed reality devices to be able to support that, to go give those alternative clinical experiences. And I'm not just talking about medics, I'm talking about the whole suite of professions. I'm talking about doctors, nurses, allied health professions. We've even got pilot studies running in care homes at the moment. So people being able to beam in directly to a district nurse or something like that, and then being able to talk through how to do wound dressings, for example. So there's some real opportunities there, but this workforce are all going to need training. And again, using your product amongst others gives us the opportunity to be able to put those clinical experiences on the HoloLens and give people that opportunity. So like I say, we're not just investing in the mixed reality devices, we're also investing in virtual reality, which lends itself really well to those one-to-one scenarios. So we can create mental health scenarios, for example, in virtual reality. And again, the feedback anecdotally has been students really love this because it's a very different way of experiencing that, and they remember it better. There was a study that came out this month in an American journal called, I can't remember what it's called now, but it was a meta-analysis essentially of all of the different studies that have been done about the effectiveness of virtual and augmented reality, and actually it was about 30% more effective than a sort of classroom experience. So there's some big changes afoot. So yeah, I think this is a really exciting future, and like I say, although we're still piloting this, I think we very much see this as the future, and we're looking to invest significant amounts of money in this going forward so that we can try and train the whole workforce this way.
Right. And are you seeing that trend not just locally in the NHS, but like through your capacity with WHO? Do you think this is something that you're seeing happening right across the world?
I think WHO obviously are working in a very different space to us. They're working with a lot of low and middle income countries which perhaps don't have the finances to be able to invest in this technology, or indeed the infrastructure, because like I say, it requires strong Wi-Fi connections and things like that. But what we are seeing is the WHO through the Academy are starting to look at augmented reality. So you can download their app now, the WHOA app. That gives you access to a nurse that is donning and doffing PPE, personal protective equipment. So it teaches a student using their own smartphone, nothing more sophisticated than that, the correct order and the correct placement of protective equipment in the pandemic and things like that. So that's their first foray into that, but I would really see that expanding over.
Right, but that's a hugely important function, right? And that's going to save lives. So that feels a very noble thing to be involved in.
Absolutely. I mean, that's why all of us work in healthcare. We're all, I suppose, without sounding too cheesy, we actually really deeply care about this. We're really passionate about this. It's quite an altruistic profession, and I think that's reflected in the work that we do.
Well, I think that's probably a beautiful way to bring this conversation to a close. Thank you for your contribution to education. The NHS, I think, is, as we said earlier, an extraordinary organization doing fantastic work. And for those on this side of the pond, we should look very closely at that as something we should hold up and be proud of. Richard, best of luck with all the work with both the NHS, with HEE, with the WHO. Keep up the good work, and thank you so much for joining me today. I'm David King-Lassman. This is Explore XR. Thank you, everyone.